Good morning. Welcome to AHA Awareness Day. I am James Romano. I'm the Legislative Coordinator for the wAIHA Warriors. I'm looking forward to speaking with you today about some of the more important issues involving public policy and coverage and access issues and patient assistance. Today we're going to talk about the importance of advocacy, congressional recognition of wAIHA, coverage and access issues, and assistance for the CAD community. The importance of advocacy. As a good friend of mine always says, if you're not at the table, you're on the menu. And so it's very important for each disease community to engage on a state and federal level to discuss their issues, to discuss their disorder and what their lives are like, basically telling their story. And it's very important that as AHA patients that we tell our story to both our state legislators and our federal legislators and those in public health. As you can see from some of the photos, the wAIHA Warriors have been engaging on Capitol Hill, and we're very excited to do so. I'm very pleased that the executive director of the wAIHA Warriors, Dr. Karen Jones, has come to Washington to build a relationship with her congressmen and different congressional offices all around the United States. She's also engaged with several of the public health agencies, such as the National Institutes of Health, and later on I'll tell you why that's important. Some of the engagement we've done with the wAIHA Warriors has been building relationships with the National Heart, Lung, and Blood Institute. And that photo earlier was with Dr. Julie Penapento, who is director of the Division of Blood. She controls the funding that comes into NHLBI for blood research, and that's important for rare blood disorders like wAIHA and CAD. And we've built a very good relationship with her. The wAIHA Warriors has submitted a CDC education and awareness grant, and we are amongst the finalists to obtain funding. This would help us build a surveillance project and work on other ways of finding wAIHA patients throughout the United States. We also worked very hard to have language that was placed in the Senate Labor, Health, and Human Services appropriations report that accompanies the bill that funds the Department of Health and Human Services. And I'm pleased to say that President Biden signed that law on Friday, making our language now law. What the importance of this language is basically telling NHLBI and the CDC that they have to work to build programs that'll help rare blood patients like wAIHA, like CAD. So this is a big victory for our community. Before, there's been no mention in the federal budget process about rare blood disorders like wAIHA and CAD. So this is a very big deal. I've attached two pieces of the that we have placed in the legislation and legislative report. So this is a big deal. We will be building on that in the coming year for the fiscal year 2025 appropriation season. We'll also be submitting a request to testify for the wAIHA Warriors so that we can go and tell them the needs of our community. Coverage and access issues. There's a number of coverage and access issues that affect the AHA community, and we'd like to discuss some of them today. A big one are copay accumulators. If you have a policy, whether it's an Obamacare plan, an employer-sponsored plan, or a self-insured plan, one of the biggest issues affecting patients with rare and chronic conditions are copay accumulators. And that's the insurance company not allowing you to use a copay card to cover the out-of-pocket expenses that you have to pay. For some treatments, the out-of-pocket expenses can be in the thousands of dollars, and you can't get your first treatment without satisfying your deductible or your out-of-pocket maximum. So manufacturers and patient assistance organizations have worked together to develop premium and copay assistance, except now that health insurers have gotten around that by saying they'll accept it but not count it towards your out-of-pocket level. So there's several states and Congress who are trying to combat this legislative problem. And I'm proud to say that 20 states, the District of Columbia, and Puerto Rico have passed state laws banning the process for plans that are regulated in those states. There's also H.R. 830 and and their Senate companion bill S 1375, which is the Help Copays Act, which again would end this process and ensure that copay cards and copay assistance count towards your out-of-pocket expense level. There's also the step therapy issue, which many insurance companies, if there's many different type of treatments, will have you fail first on a cheaper treatment, then go forward with the latest or the newest innovative novel therapy. And sometimes it's you're failing on steroids before you get your first FDA approved treatment. And so there's bills such as the Safe Step Act that would prevent it. Recently, you've heard that another big issue maybe facing our community is certain entities are going to try to, if elected into power, will try to remove the patient protections of the Affordable Care Act, or as it's affectionately named, Obamacare. And again, it's important that that they don't remove the reform on pre-existing condition exclusions, so that your insurance company has to work with you even if you have a pre-existing condition, such as wAIHA or CAD. So it's very important that we monitor that moving forward. I wanted to also discuss that there's actually a patient assistance program right now to help the cold agglutinin disease community, CAD. Um, the nonprofit that runs it is the Assistance Fund. And what basically the program is health insurance premium assistance, copay assistance, and other types of assistance, including travel assistance for cold agglutinin disease patients. To be eligible, you have to meet a financial criteria, being in a certain federal poverty level moment. You'll also have to be a U.S. citizen and being prescribed the FDA approved treatment for CAD. You need to go to the Assistance Fund, taftcares.org, or call the number below, and they can help you fill out an application to receive premium or cost sharing assistance. This is very important if you cannot afford your treatments or your health insurance. There are organizations out there that will help you do that. These are wonderful organizations that can make sure that you're getting the treatments that you need. And hopefully in the future, there'll be similar type programs for the wAIHA patients as soon as they have a approved treatment. So thank you very much for allowing me to talk to you for a few minutes on AHA Awareness Day. It's very important that you become involved, that you contact your legislators so that you know who they are and they know who you are. So when you come to them talking about wAIHA or CAD or other different type of autoimmune blood disorders, that they remember you, and they'll start working with you to recognize that disorder in your state legislature or in Congress. So thank you very much, and I look forward to working with you.